So you have to talk about it. Yeah, okay. So if you go through all those steps, communication, asking all your questions. Hello guys, hi, this is Dr. Chaifel. So we already talked about in our episode 3 about types of hair transplant. So now your next question will be, how do I know which one I qualify for or which one will be good for me? So number one, I have four major points, and to me, these are really the one that, the major big deals for me. After that, every other thing you can discuss that with your hair transplant surgeon. So number one is communication. So the ability to communicate with your hair transplant surgeon, and it starts when time for evaluation. Okay. After your evaluation, your examination of your scalp, then you ask the questions. What does it involve? What does it involve? What type of hair transplant will be best for me? Okay, expertise of the surgeon, and aftercare plans and complications. So you have to communicate. You have to ask all those questions. Whatever you've read online, you need to scrap that, bring in all the questions, and talk to your doctor. That's the most important thing. You need to talk to your doctor so that they can answer all your questions. If your doctor is not able to communicate with you, then I do not know about that. Then number two is very important, which is medical history. If you have a history of a clotting disorder in your family, or if you personally have any history, you have to disclose that. If you take any blood thinners, it's very important for you to disclose that. If you also have a history of keloids, you have to disclose that. If you have a history of keloids, maybe FUT or the strip surgery won't be good for you because, like the name implies, you take a strip of skin, so you don't want to have a big old scar. But now we have better suturing techniques that we can avoid that. But still, it's best for you to disclose that you have a history of keloids. How do I know if I have a history of keloids? Many people will ask, have you had any surgery in the past? Have you ever pierced your ears before and you had like a big old scar behind your ear? Or does it run in your family? Okay. So some people are prone to keloids. So we have to know that if you're prone to keloids, then we might need to avoid the strip surgery. So number three, we're going to talk about styling and hair texture. So if you have a type 3 or type 4 hair texture, afro textured hair, curly hair, then you might need to discuss that with your doctor if your doctor is very knowledgeable in handling those textures of hair. Okay, so talk to your doctor and see if your doctor has expertise in there, is able to do hair transplant in people with curly hair. So talk to your doctor about that. Then styling techniques. So let's say if you want to carry really short hairstyles, a strip surgery might not be the best because you don't want the scar to be showing. Okay, might not be the best for you. But if you're going to keep your hair long, then it's okay to have either one, either the strip or the FUE. Then number four is price point. You need to talk about price, and that's the truth. You got to talk about price. You got to talk about it. You have to talk about it. You have to talk about it. Okay. How am I able to pay? Do you have in house financing? Yes. Or you want to pay cash? So you have to talk about it. Yeah. Okay. So if you go through all those steps, communication, asking all your questions, you talk about your medical history, you talk about your styling, how you want to carry your hair, then you talk about the price. So once you agree on all those 4 points, then the sky is your limit. Okay. Then you can set time for your hair transplant and go for it. And it's going to be the best decision you ever make. Okay. Bye bye.